Treating the symptoms of COVID-19, the mild symptoms in kids, is really the same as treating any other viral respiratory illness, such as colds and the flu. So that's going to be lots of rest, lots of fluids. Your immune system needs plenty of those in order to make a successful fight. You'll also want to use fever reducers, especially if your child has a fever of 100.4 degrees Fahrenheit or higher, or if they have aches and pains, headaches, sore throat. Just to help them feel more comfortable, you can use medicines like acetaminophen or ibuprofen. You'd want to follow the package label in terms of your child's age and weight. Of course, if there's any question about dosing, you would want to contact your child's pediatric provider, and they would be able to guide you on how much of those medicines to give your child. We want to avoid aspirin in all kids unless your doctor specifically tells you to give it. It can be dangerous for many children. And then kids who are less than 6 months of age, we only want to use acetaminophen or like the brand name Tylenol, and not use ibuprofen such as Motrin or Advil and other brands. Again, if there's any question, especially for those young kids, on what fever reducers to use, be sure to call their doctor and ask. We also just treat with what we would call supportive care. So that's the rest, the fluids, the fever reducers, but also just comfort. You know, a humidifier in the bedroom may be helpful, especially if they have some nasal congestion and cough associated with it. Kids who are over 12 months of age, you can use some honey to help soothe the back of the throat. You want to dress them so that they aren't feeling too warm, they're not feeling too cold. Really, comfort is the mainstay of treatment for these mild respiratory symptoms. If your child begins to have more severe symptoms, so trouble breathing, anything that makes you look and say, that doesn't look quite right as they're breathing, then you definitely want to get them help right away, whether that's calling your doctor for advice if it's sort of on the cusp of those more severe symptoms, or taking them into an urgent care or emergency department. And of course, if the symptoms are very severe, call 911 and get help right away.